afternoon, everyone. My name is Tia Teriak. Welcome to What's Up, Doc, a monthly lecture program of the Concord Hospital Trust, which is the philanthropic arm of Concord Hospital. At this time, we'd like to recognize and thank the Walker Lecture Series for their generous sponsorship of What's Up, Doc. The Walker Lecture Series was established here in Concord in 1892 from a bequest in the will of Miss Abigail Walker. Per the terms of her will, the Walker Series offers lectures on history, literature, art, and science, as well as dramatic, musical, and literary performances. And the very cool thing is all events are free to the public and are held at the Concord City Auditorium. We encourage you to check out their website at walkerlecture.org to view their calendar of programs. We have a terrific program for you today. Our guest physician is Dr. Raza Sharif. Dr. Raza Sharif is an American board certified general surgeon. He is the director of the Metabolic and Bariatric Surgery Program at Concord Hospital, Laconia, and he also serves as the medical director of the Weight Institute of New Hampshire. After completing his fellowship in minimally invasive bariatric and general surgery at the University of Pittsburgh, Dr. Sharif helped establish the Bariatric Surgery Program in Laconia. The Weight Institute of New Hampshire is fully accredited comprehensive center for bariatric surgery. Dr. Sharif also serves as the chairperson of the Department of Surgery at Concord Hospital, Laconia. And in addition to bariatric surgery, Dr. Sharif has expertise in minimally invasive foregut surgery, including surgery for reflux and heartburn and complex hiatal hernias, as well as advanced laparoscopic procedures. Dr. Sharif also serves as clinical assistant professor of surgery at the University of New England College of Medicine, where he is closely involved with the education of medical students. Please join me in welcoming Dr. Raza Sharif.
Thank you, everyone. Thank you. Yeah, I'd also like to acknowledge our great team from the Weight Institute. We have Kathleen Hayward, who's our program coordinator, Tricia Kevel, who's our bariatrician and nurse practitioner, and Elizabeth, who's our dietitian. So you'll be hearing from all of us today. Thank you.
Hello, everyone. Thank you so much for having us. We are so excited to be here. My first question for anyone is, have you ever heard of the Weight Institute in New Hampshire? All right, we got a couple of arms. That's awesome. All right, so the Weight Institute in New Hampshire was actually founded in 2012. And in 2013, we started our bariatric surgeries. And throughout the years, we've gradually added on additional programs to help with weight loss and weight management. So we're here today to share with you not only our more aggressive form of weight loss, which is our bariatric surgery, but also our more less aggressive form, our non-surgical weight loss options for you as well. So we have us four lovely people here today that are all going to be presenting. However, I also wanted to share with you the others that help us with our program and what it is today. So we also have two other dietitians on staff as well. We have Molly, she's our office nurse, and she sees everyone through our bariatric surgery program. And we have Maria, who is our medical assistant, and she follows everyone through our Optifast program, which we are going to share with you in detail about these programs. We have our patient care service representative, Denise, and we also have Carolyn Muller. She is a community educator for us in Laconia, and she actually co-facilitates what's called our lifestyle class, which is designed for our bariatric patients. It is mandatory for them to attend, and mainly it focuses on behavior modification, lifestyle changes to help them be successful before surgery and set them up for ultimate success for after surgery. We also have Lisa Martin. She is our psychiatric nurse practitioner, and she does our psychiatric evaluations for all of our bariatric patients. So, the question is, why do we even exist? Why did we even come here today to talk to you? So we're talking about obesity. Does anyone know how extreme this is in the United States, how rampant it is, and it's actually considered a pandemic right now? Or epidemic, sorry, epidemic. So let's just take a little look as far as the history in the United States. When I refer to obesity, what we're referring to is a BMI greater than 30. Now, BMI is just a quick, easy assessment tool to basically assess someone's body fatness, per se, or how much overweight are they. So when someone has a BMI greater than 30, they're at least 30 pounds overweight. So if we go back to 1990, we take a look at the obesity rates in the United States. So we are only looking at about 10, 14% of the United States population was suffering from obesity. Then we stroll on down to 2000. We're looking a little bit different here. You can actually see we got some dark blue and we got some tan colors going on. So what that is signifying, we're at about 15 to 24% obesity rates in the United States. Then we hit 2010, the map looks completely different colors. So we actually have a lot of reds here, and the red is representing about 25 to 30% obesity rates. So clearly, obesity in the United States is growing. It's not going away, and it's getting worse. If we were to take a look at 2020, this actually looks a little bit different. Unfortunately, the coloring schematic is a little bit different, makes it more difficult to understand. But if you notice, take a look. This green, we only have a couple greens going on there, and that's about 20 to 25% obesity. Everything else is in the red and dark red, which is about 30 to 40% or more obesity in the United States. Does anyone have any idea, as far as today, 2022, what our rate is for obesity for US adults?
40, 45%.
My gosh, you're right on. Yes, it's 43% of our US adult population is suffering from obesity. The future for us is not looking any better in 2030. Any guesses for that one? Oh my gosh. You did this presentation before, right? Yes, it's actually about 50%. Half of our US adult population is going to be suffering from obesity. Now, that's just some of our population that has an obesity about 30 pounds overweight. There's a lot of people that have extreme obesity, which is greater than 100 pounds overweight. And that number is expected to significantly increase as well come 2030. So clearly, there is a need. There is a need for the Weight Institute in New Hampshire. And that's what we're here today, to go over the different programs that we do offer to all of the citizens and the patients in the Laconia area and the Concord area and all surrounding areas. So, we already covered some of that, but what is really wonderful, and it really makes me happy, is that the World Health Organization actually announced that obesity is now considered a disease. It's no longer considered just someone who, they don't eat well, they overeat, and they don't exercise. That's no longer what it's considered. Because there's such a stigmatism with people who are suffering from obesity. And it's, for most people, it's just not overeating and under-exercising. There's so many other factors that go into obesity. There's things as far as, think about all the medications that we have today. So many medications contribute to weight gain. We also, think about, as far as a pregnancy goes, inadequate sleep is another big one as well. When you don't get adequate sleep, your hormones that make you feel hungry skyrocket. And then our hormones that kind of blunt our appetite decrease. There's so many underlying, all of these factors that, to be honest with you, we don't completely understand the whole disease obesity. It's still evolving, and we're learning so much more as we go. But what we have here today is a fantastic team that offers both the surgical options and the non-surgical weight loss options to help us through this. So in regards to the different options that we do have here at the Weight Institute, and each of Elizabeth, Dr. Sharif, and Tricia are going to speak to. Dr. Sharif is going to speak about bariatric surgery. That is going to be our most aggressive form for weight loss. And then we also have medication-assisted weight loss, and Tricia's going to speak to that. Now, when you think about medication, it's not just like a magic pill. You know, you see on TV, like, oh, don't move a muscle, just do this. You know, if there was anything magical like that, we wouldn't have this epidemic going on right now. So with the medication, and Tricia will speak to this, it helps decrease your appetite, but it doesn't change the way you eat, and it doesn't change the way you move your body. Just like weight loss surgery. I always tell patients, Dr. Sharif is not operating on your brain. And the way that you think about food, the way that you feel about food, it doesn't change, you know, if you're an emotional eater, if you eat when you're bored or you're stressed. He can't fix that. But what he can fix is the amount that you can eat at one time. And our program is very extensive in regards to our bariatric surgery program, because any center can create their own bariatric center, and people, they can choose to do what they want to, but our main focus at the Weight Institute in Hampshire is on behavior modification. Because ultimately, if you don't correct the problem at hand, then ultimately they're not going to be successful after surgery. So we really try to focus on the person, the human being, and helping them make changes for positive weight loss after surgery, a year out from surgery, 10 years, and thereafter. Our Optifast program is a medically supervised weight management program that incorporates bars, soups, and shakes. We have a weekly weigh-in, which is a weekly class that people come in, weigh themselves, and Elizabeth will speak more about that. And then we also have one-on-one nutritional counseling. What is really wonderful is that we offer free informational sessions, which means if I were to call the Weight Institute in Hampshire, hi, my name is Kathleen, you know, I need to lose a little bit of weight here. I don't know what I should do. So we have them attend informational sessions, and they get to learn about all of our different programs. We have our surgical informational session and the non-surgical informational session. So they can actually hear from us, the experts, the programs that we do have, and they get to make those options, and we help them make those options as well. So I'm going to hand it off to Dr. Sharif, and he's going to speak to our bariatric program.
Good afternoon, everyone. Kathleen, thank you for the introduction to our program and also the introduction to obesity. So I'm sure a lot of you are wondering why surgery for obesity. It sounds extreme. And to be honest with you, that was my first reaction to it when I first heard about bariatric surgery. This is about 15 years ago. I said this is extreme. We shouldn't be needing surgery to treat obesity. But like Kathleen pointed out, obesity has become an epidemic. About 40% obesity, and a substantial portion of that is severe obesity. And what we've realized is that once you get to severe obesity, which is a BMI over 40, non-surgical weight loss measures have very low success rates. They're great for people who are overweight and obese, but once you're getting into severe obesity, the success rate drops. So in fact, the NIH conducted a very large study where they gave people a simple goal, a 10% weight loss, and try to keep it off for 1 year. So ideally, for somebody who's severely or morbidly obese, you want them to lose about 80 or 100 pounds and hopefully keep it off the rest of their life. So the goal that the NIH set was very simple, 10% weight loss, keep it off for 1 year. So if somebody's 300 pounds, which is where which would fall in the morbid obesity spectrum for most people, it's a 30-pound weight loss, and you're trying to keep it off for a year. And what they found was the success rate was less than 10%, less than 1 in 10. So clearly there is a need to do something more. And clearly the obesity pandemic or the epidemic is impacting the health system. It's now the largest preventable cause of death. It's far more preventable deaths from obesity than it is from tobacco smoking, about 6 to 7-fold higher. So something clearly needs to be done, and bariatric surgery is a great great tool. Now, not only does bariatric surgery help with weight loss, it helps cure a whole host of other medical conditions, and we'll look into it. So people are able to get off some of the medications that they are on, live longer, and more importantly, have much better quality of life. So here's a quick snapshot of the results that you can expect from bariatric surgery. There's multiple studies, newer data that's coming out each day, but this is a synopsis of the outcomes of bariatric surgery. Some of the initial studies came out in regards to diabetes, and we've shown that there's up to 80% cure rate for diabetes with the Roux-en-Y gastric bypass. A lot of new data about the reduction in your cardiovascular risk, about an 80% reduction in cardiovascular risk and substantial reduction in 5-year mortality from heart disease. Similarly, there's substantial reduction in risk of stroke. A lot of people who are overweight and obese have undiagnosed obstructive sleep apnea, and bariatric surgery can help either cure or improve it in over 3/4 of the people. Even something like fatty liver disease, we're seeing a lot of this. Almost everybody that I do surgery on has some degree of fatty liver disease, and that can progress to cirrhosis, which traditionally was either from hepatitis or alcohol. Nowadays, a lot of cirrhosis that we're seeing is secondary to fatty liver disease. And what we see is that after surgery, about 90% of the fatty change in the liver improves, whereas once you get to cirrhosis and scarring, there's only a 20% improvement. So you want to intervene before all of these negative physiologic changes happen in the body. Even something like polycystic ovarian syndrome, you find that there is substantial improvement in weight loss surgery, which just goes to show you the negative hormonal changes that happen with obesity and how weight loss surgery can reverse some of these. Overall, about a 90% reduction in 5-year mortality in somebody with severe obesity who has bariatric surgery performed, and about 95% of the people experienced an improvement in their quality of life. So bariatric surgery really works in the severely obese person. Not only helps reduce weight, it helps improve or cure a whole host of the associated medical conditions and a substantial improvement in the quality of life. So who qualifies for surgery? We decide this based on BMI. So normal BMI is between 19 and 25. Once your BMI goes above 25, you're overweight. A BMI above 30 is obese, and a BMI above 40 is morbidly obese. So what that means is that at that BMI, you're certainly going to start seeing the negative consequences of being overweight and obese. So anybody with a BMI over 40 would qualify for weight loss surgery. You would also qualify for weight loss surgery if your BMI was between 35 and 40, if you already had an obesity-related medical condition like diabetes or high blood pressure or heart disease. So the NIH came up with these guidelines after, again, very extensive research where they found that the risk of staying at a BMI over 40 was substantially higher than the risk of any adverse impact or adverse outcome from the surgery. Now, again, I know there's a lot of apprehension, there's a lot of stigma attached to bariatric surgery. The ASMB has put out some very good data which shows that bariatric surgery is far safer than a lot of the commonly performed surgical procedures like gallbladder surgery, laparoscopic cholecystectomy. It's safer than joint replacement. It's safer than hysterectomy. So we've come a long way in terms of improving outcomes in bariatric surgery, and it's now it can be performed very safely for most people. So a quick word about the different surgical procedures. The two procedures that we offer at the Weight Institute are the gastric bypass, the Roux-en-Y gastric bypass, and the sleeve gastrectomy. The lap band is a procedure that was fairly popular back in the day, but has fallen out of favor just because the long-term outcomes were not good. But both the bypass and the sleeve have very good outcomes. The advantages to the bypass, weight loss is quite rapid. It cures diabetes really well. Unlike a lap band, you don't have to come in for routine adjustments to the office. It is major surgery. There is rerouting of the bowels that is involved. It is difficult to reverse. There is a small risk for nutritional deficiencies. like with any surgery, there is the potential for complications. We worry about leaks and anastomotic ulcers and internal hernias. Again, we've gotten better. Techniques have evolved where we see less and less of these complications. The gastric sleeve, comparatively simpler surgery. We're not doing anything with your bowels. We're dividing the stomach along its length and removing about 2/3 of the stomach. So it mainly works by limiting how much you can eat, but also there are beneficial hormonal changes that take place after a sleeve, which suppress your hunger and help with weight loss. Weight loss with the sleeve is pretty good. It's on average slightly lower than it is with the bypass, but still much better than it used to be with the lap band. A sleeve also does provide reasonable cure of diabetes, but the bypass is better. A sleeve is irreversible. Again, surgical risk, we worry about leaks, but fortunately, it's not very often that we see these. So here at WIN, we've been performing surgery since 2012, 2013. We've performed over 400 surgical procedures. The gastric bypass used to be very popular, but now the sleeve has become the most commonly performed procedures. I perform about 2 to 3 times as many sleeves as the bypass. I'd like to talk about the Mbs Equip Accreditation. So this is a program run by the American College of Surgeons. It's one of the most robust, quality-based accreditation programs that they have. And there's 2 levels of accreditation, a low acuity center or a comprehensive center. So we used to be a low acuity center. We became one in 2015. And since 2018, we've been a comprehensive center for bariatric surgery. And what that means is that we can do surgery on older people, people with higher BMIs. We can do revisional bariatric surgery, and we can do surgery on people with who are considered higher medical risk. So we have been performing revisions, higher BMI surgery, and surgery on people with more medical comorbidities for the last 4 years, still with very good outcomes. This is our weight loss outcomes 1 year after surgery. We have 80% excess weight loss with the gastric bypass and 72% excess weight loss with the sleeve. So our outcomes for both the bypass and the sleeve well exceed national outcomes for weight loss. Same goes for improvement of medical conditions. Our outcomes do exceed. We've seen better outcomes, and that's testimony to the comprehensive program that we run. We obviously take great care in doing safe surgery, but we also, like Kathleen mentioned, have a very robust team where we focus on behavioral modification and help improve people's lifestyle. So this is our semi-annual report on outcomes of bariatric surgery. So part of the accreditation process is that we have to submit outcomes on every single procedure that we perform, and thankfully we've had very good outcomes. All we had was one readmission for a non-surgical complication in all of last year. So we're quite proud of our outcomes here at WIN. What does the program itself involve? So like we said, we have a comprehensive program looking at dietary modification, behavior, and lifestyle change. If somebody is interested in bariatric surgery, they meet with me. I go over their medical history. For the most part, I let them decide what surgery they feel is best for them, but I'll help them make that decision based on their medical history. After that, they meet with either Kathleen or Elizabeth or one of our newer dietitians. They're put in one-to-one where they're put on an individualized diet plan that we really expect them to follow strictly, and it's multiple consultations with the dietitian. We have them meet with Tricia, who goes over their medical history, does very extensive nutritional lab work, and optimizes them for surgery. We have them attend a 4-week lifestyle class in preparation for surgery and in preparation for the lifestyle change after surgery. They do meet with a psychologist. The goal of this is to identify those people who need help going through the process. It's not designed to be punitive. It's not designed to eliminate somebody from the program. It's designed to identify those people who need help. We also focus on exercise and people staying active. So once they've completed the whole process, we bring them to surgery, and Most people go home the next day after surgery, sometimes an extra day. We have a very close follow-up with them afterwards. They meet us multiple times in the first 6 months during their rapid weight loss phase. So that's the program in a nutshell. And again, we've had excellent outcomes over the last several years. And we hope to offer our services here in the greater Concord area. Very good. Tricia will talk to you about medication-assisted weight loss next.
Medication is a fairly new program at the Weight Institute. We started about 1.5 years ago. It's a comprehensive program that combines lifestyle changes with the assistance of medication. Medication is a great tool to help people, helps to suppress their appetite. But it's only a tool. It does not take the place of eating right and exercise. We do require with the medication program that you meet one-on-one with the nutrition counselor, and you have to meet at least 3 times with them. And there are multiple medications for weight loss. These are all the medications that are FDA approved for weight loss. There is one here, Orlistat, that is basically the only one that works in the gut. It works by your body not absorbing fat from the foods that you eat. The rest of these medications all work in the brain, basically to suppress your appetite, make you feel full sooner, make you basically want to eat less. These meds here on the top are all approved for long-term use, so there's no end in when you have to stop taking them. The last group here are only approved for short-term use, however. So if you come in and say, well, I'm interested in medication weight loss, basically we'll look at your medical history, other medications that you take to see what would be the best medication for you. There are some barriers as far as interactions with other medications, so it really depends on what you already take. And also, insurance can be a little bit of a barrier. Not all insurance cover medications. Many don't cover any at all. So there's ways that we can, a couple of the meds, these two have savings programs online that we can get you hooked up with, and it's cheaper. But not everything is covered by insurance, unfortunately. But it works great. People that don't have a significant amount of weight to lose, it does help. Usually we see about 10 to 12% weight loss with the medications. Basically, we'll work with you with the dietitian to help you through the medications. However, it's a slower process. So unlike the Optifast, where you have rapid weight loss or surgery, medications you see a little bit slower process with the weight coming off. So if you can be patient and work with us, we'll help you through that. And then we are on to our Optifast program, another non-surgical weight loss program. Thank you.
I am Elizabeth. I'm a dietitian at the Weight Institute. I've been at the Weight Institute for about 8 years. I primarily do a lot of the non-surgical weight loss options. And the two that we've already talked about today I view as more aggressive treatment forms for obesity. And I do the less aggressive treatment forms. I'm going to start with our Optifast program, although I still view this as pretty aggressive because it does have a fairly high commitment level. It is medically monitored, and it does have a pretty good calorie restriction as well. So Optifast is our meal replacement program, and our meal replacements come in the form of shakes, soups, and bars. The shakes are chocolate, strawberry, and vanilla flavored shakes, and the bars are peanut butter chocolate, chocolate and apple cinnamon, and then there's 2 flavors of soups, vegetable and tomato. Now, part of our Optifast program is with this meal replacement, it is based on the concept of stimuli narrowing, which means the lack of choices leads to lack of cravings. So we don't have many choices while you're on this program. You get those choices. So we do offer 2 Optifast programs right now. We have a full fasting, which is the 800 to 900 calories a day, and then there's the partial program, which is 1,200 calories a day. Now, if you choose to do, or if a patient chooses to do the full fasting, what it is 12 weeks on our active weight loss phase, which is only 6 Optifast products a day for 12 weeks. And that provides that 800 to 900 calories. And then after that 12 weeks, there's a 6-week transition phase where patients would get less and less product and more foods per se. So it is an 18-week program. It's done in 18 weeks. Our partial program is 1,200 calories a day. Its active weight loss phase consists of 4 Optifast products and then a meal that you would prepare from the foods in your family or your home. And you do that for 12 weeks, and then there's a 6-week transition phase after that as well. So that's also an 18-week program. During the 18 weeks, it is medically monitored. So Tricia medically monitors all the patients. The partial, with its very low calorie, has more medical monitoring than the partial with the 1,200 calories, but both are still medically monitored. And during the 18 weeks, there's weekly nutrition education sessions as well. It is a set curriculum where we talk about everything from label reading, salt, sugar, fat, but we also talk about some of those more, I call it the touchy-feelier sides of foods, like mindful eating and emotional eating, and setting the right goals for weight loss, trying to get the right support behind you when you're trying to lose weight, all these other factors that play a role. So the behavior modification side. So that's what we cover over the 18 weeks. So with this as well, something I like about our Optifast program, if you choose to do the full or if you choose to do the partial, the only difference between the two programs is your calorie allotment, right? So it's the same education, it's the same support, it's only you're either on 800, 900 calories or you're on 1,200 calories. During the classes, we have one class set up on Mondays midday and the other one is on Thursdays in the evening, so we can hope to capture everybody. And so you come to one class. You also, people who participate in the Optifast program, they do not need to wait for a new class to start. They're always on a continuous cycle. So people can hop on at any time, and they'll be in classes with people who are on the full, people who are on the partial, people in the beginning, the middle, the end of the program. One thing I absolutely love about our Optifast program as well is that we offer free lifelong support. So once the 18 weeks is complete, we don't lock the doors and say good luck, right? We continue to offer free lifelong support so people can continue to attend the Optifast classes for free forever. I have some people who have never left. I have one woman who is down 85 pounds and has maintained that 85-pound loss for 3 years. And she continues to come to 2 Optifast classes a month. Right? We have some people who leave and come back when they need a little bit more help. It's something that's offered to them. And I really like that about our classes. And yeah, so the average weight loss, this is the weekly weight loss that we usually see, but the average weight loss for the full fasting is about 50 pounds for the 18 weeks, and for the partial, it's about 30 pounds. Now, I often get the question, how is Optifast different than any other meal replacement program? Almost like an over-the-counter one, like a Slim Fast or a Beachbody. How is Optifast different from those? And I think it is because we have set up such a nice program where we do look at the patient individually, and we really work on behavior modification. I agree that many people can lose weight on meal replacements or a calorie restriction, but we want to give you the tools to be successful in the long run. I oftentimes compare losing weight to digging a hole, right? And you can dig a hole with your hands if you want to, or you can have a shovel, right? And it's still a lot of work to dig a hole with a shovel, but it's very helpful, right? And Optifast, the meal replacement is a shovel, but the tools that we give through the education is more of the long-term success that we like to see. All right, so another program, now we're getting into the more conservative forms of treatment with the weekly weigh-in. And we have designed the weekly weigh-in to be similar to Weight Watchers. Everybody who comes to this group, and we meet on Mondays, everybody who comes to the Monday group is on a special meal plan. They are expected to weigh, measure, log their intake as well. And then they weigh in weekly as well, so we can monitor their weights every week. And then in the group sessions, they're very health and nutrition oriented. And I have been, we've been doing this for years, and I got to come up with a topic every Monday, right? So if it's health and nutrition related, we talk about it. We talk about label reading and salt and sugar and fat, but we also talk about exercise and emotional eating. We talk about how to store your vegetables to get the longest life out of them, because there's some vegetables that shouldn't be stored next to each other because they're not friends, right? They don't last as long, right? So we have those conversations as well in the class. And that is our weekly weigh-in. And the last program I want to talk about is our one-on-one nutrition counseling. And our one-on-one nutrition counseling is really very patient-focused. Our first meeting is an hour long, and we really spend that good hour trying to get to know our patients. We do want to know what their goals are. What are they looking to accomplish? But we also want to know, where do they live? Who's in the house? Do these people play a role in how we eat? Do you work third shift? Because that affects your eating patterns for sure. We want to know what their current eating patterns are, what will they eat, what won't they eat. We look at the whole big picture. And typically people will leave with a meal plan on their way out. And the meal plan is very simple, typically based on portions of food groups. Follow-up meetings, though, we do get more and more and more specific as we go. So the person leaves pretty well educated. Oh, I forgot to say something else we want to know when we meet with the patients is we do want to know their weight history, right? What has their weight history been? What has worked in the past? What hasn't worked in the past? So we can grow on what the patient's already tried and done. So the 30-minute follow-ups, the first meeting's an hour, and then we have 30-minute follow-ups where we get more and more specific. The nice thing about the one-on-one is we direct it in however the person sitting across from us wants to go. If they have a topic they want to talk about, like making menus based on what we talked about last time, yeah, well, let's make menus. But if a patient comes in and they're not sure what they want to talk about, I know I love talking about nutrition and physiology, so I always have something to talk about, right? So we get more and more specific as we go. So one of the great things I really like about the Weight Institute is our fluidity. We all work together. We all came here together. We all work together. And weight loss is not a one-size-fits-all. Right, and so we need to be able to shift and move. And I've had people who started one-on-one and have gone to more intense programs. I've had people who've started one-on-one and gone to the surgical program. We've had some people who've started surgically, and then they've done so well with the weight loss that was required, they decided to put off surgery for a couple more years. Right, that is something that is very good. I have somebody who's in the weekly weigh-in and on medication. So we're very fluid and we work very well together. And once somebody decides to work with us, no matter what program they decide to do, it's very, we can shift and move and work with the patient to get them where they need to be and where they're at that moment in time, right? Because it's always going to change. So I think that's about all I have. I want to thank you for your time.
Great presentation, Dr. Sharif and your team. Very heartwarming as well. Wonderful to see on behalf of the entire Concord Hospital Trust staff. Thank you for joining What's Up Doc today. We hope learning about the Weight Loss Institute of New Hampshire and the awesome people that provide health care there has been informative and helpful. We hope you will share this information with family, friends as you go along. Please join us next month for What's Up Doc. We welcome Dr. Alexandru Vida, who will be here from the Cardiovascular Institute, and his topic is treating lung cancer, a surgical approach. Please stay safe, stay healthy, and be happy. Spring is coming. Thanks so much.